According to the Cleveland Clinic, 28% of patients tell at least one lie. But listen to this. However, doctors estimate that, in fact, 77% of us are lying about our health.
That's a lot, and I'm sure that's a problem. We have Dr. Caudle in this morning. I know you say it could be very dangerous.
It absolutely can. Good morning, guys. You know, this is a really interesting study because it shows that a lot of people aren't really being truthful with their physician. You know, as a family practitioner, I see a lot of people who sometimes aren't truthful with me. Things that sometimes people aren't truthful about include things like, are they taking their medications? Are they exercising? Smoking, drinking, even using drugs? And sometimes even sexual activity. So, yes, this can be dangerous to lie, but it's happening a lot.
So, okay, I'm taking my medication. Oh, yes, I don't smoke anymore. What's another good common one?
Oh, well, the smoking, the drinking, the drugs, okay, sexual activity, taking medications. Oh, sometimes people aren't always honest about if they're using over-the-counter supplements. You know, that's something that's very important to me as a practitioner. I want to know this. Some people aren't truthful about whether they're getting second opinions. They may not tell you if they're doing this. Some people actually under-exaggerate their symptoms, maybe because they're afraid of what the diagnosis may be. But some people actually over-exaggerate their symptoms. So there's a range in which people can sort of be untruthful with this.
See the women standing behind you, the people behind you? I want you to talk to them after you leave the air, okay? And just make them tell you the truth.
Well, I mean, I guess obviously there are dangers to lying, but I think a lot of times, Mike and I were just talking about it, you know, you don't want to be judged.
Right.
You don't want, I guess, what are some of the other reasons why? Well,
you know, there's a lot of reasons, and you're so right about that. Some people really, they're afraid of being judged. They might be embarrassed about what the truth actually is or ashamed. You know, some people are afraid of what the diagnosis might be if they tell you the truth. And yes, some people are out for secondary gain, but I think a lot of people are just sort of feeling uncomfortable about this.
Well, yeah, it's the old ostrich in the sand. You know, you stuff your head down in the sand and you say, I don't want to hear it. Doctor.
Ignorance is bliss.
I've heard another one, too. Well, when was your last checkup? I do this at the dentist all the time. Oh, yeah, my teeth cleaned about 3 months ago. You know, it was 3 years ago. And another one I heard that pediatricians get is, now, is the baby, you know, sleeping on its back or on its stomach? Oh, of course, when you know it's not.
Right. Well, you know, it's so important to be truthful with your physician because remember that as doctors, you know, we make our diagnosis and we prescribe medications based on what we see and what you tell us. So if you're not telling us the truth, you know, it really leaves the door open for misdiagnosis, and truthfulness is important. And, you know, the other thing I have to say about this is, remember, your doctor is supposed to be your advocate. It's supposed to be, we're supposed to be that person that helps you through times that are good and bad. So if you're embarrassed about something or you're uncomfortable with something, your doctor is the person you should be able to talk to kind of get you through.
I would never lie to you.
Glad to hear it.
Thank you, Dr.
Well, just real quickly, can you sniff out a liar in one word?
Sometimes.
No,
sometimes.
Sometimes.
Yes.
All right. Thank you, Doc.